few months, and the toilet of male medical ward, it fell one day, one time, and the patients of Ward 3 have been easing themselves with our patients on Ward 4, which was really not the best order. We thought of if one reps one from there, because remember we have 2 bathrooms and 2 toilets. A male can be there with a female, and then things can go wrong. We thought of someone, if he collapses from there, because the toilets even became too full, and we remained with only 1 toilet. We started crying for help. We tried in the presence when Dr. Florence was still around, but good enough when Dr. Namala came, she has really helped the situation. She has renovated Ward 2, she has renovated Ward 3, she has constructed a new toilet for the patients. She has built for the labs, those patients who have been easing themselves in the bush and whereabout. She has put a new toilet. The kitchen where tenants cook from, she has constructed at least 1. We really appreciate Dr. Namara. May she live long.
I want to appreciate the hospital administration, more so the hospital director, Madam Angela Namara, who took the initiative to have these buildings renovated. Actually, if one ever came to our ward before renovation, instead of coming to get healed, you instead go back sick. I want to thank the administration for planning effectively. MCH is one of the key things that we look upon, and we want to promise as a ward that we are going to maintain the standards of this ward, not only the building, but we want to acknowledge that we will offer a service that the community desires in terms of maternal child health as regards to this ward.
It so happened that we're given these wards, which we found in a very, I would say, not so good state, but you might not see what has really gone in there, but a lot has gone in. And we are very happy as a team. You might not be seeing the teams that we had. Initially started with very many teams which required breaking and renovating, and finally the last court which everyone is seeing. But it has taken quite a lot of work and resilience and fights and here and there trying to break and make good and break. We've gone through a process of breaking, make good, then you see it's not okay, and break it again.
This is not my personal money. This is money we accumulated through the G2G savings. G2G is an initiative for government to government. It's a USAID program, and it has been with us since 2020. And during these G2G activities, actually G2G looks at HIV, we have a maternal child health component, they do a lot of field work, and they have targets. Once this team meets those targets, we get money. So we accumulate savings. So we don't forget to thank the G2G staff who worked tirelessly that we could save this money. So when we saved that money, management chose to spend the money on renovation of a few buildings. This is the beginning. We need to encourage the G2G staff to work much harder, because I don't see any other source of funding where we shall get money to have some of these renovations.